Good morning. I've been joined by the Chief Health Officer, and I've also been joined by Naomi Bromley, who is a Senior Health Department official in charge of the vaccination program. So there have been 12 locally acquired cases from yesterday that the department released in this morning's numbers, and they're all locally acquired with 0 cases through hotel quarantine. That brings us to 159 cases over the 12-day period of this outbreak to date, all Delta and all linked to the New South Wales incursion. We have 10 cases in hospital, 3 in ICU with 1 on ventilation, and I'm sure we all send our best wishes to those people and their families and carers and supporters, and thank our hard-working hospital frontline workers for the care they provide. There were 19,281 vaccination doses administered through our state-run clinics yesterday, and that was accompanied by some 39,846 COVID tests that were also done yesterday. Overall, we're pleased to see an encouraging trend down in case numbers, and certainly not an increase. Not a huge trend down, but in terms of the direction and particularly the issues that the Chief Health Officer will go into, a reassuring trend towards the cases overwhelmingly being in quarantine, being in home isolation for the entirety of their infectious period. The number of people moving about in the community when infectious, as I say, is trending down, which is a good thing. That's a critical part of stopping the virus spreading in our community, and when attended to, the wider restrictions that are in place gives our public health team the confidence that they can look to. Too early to call yet as to what might be the position come Tuesday night. As I indicated, 10 of the 12 community cases were in isolation during their entire infectious period. The 2 cases who were out in the community were only active in the community for less than a day, with only a small number of retail sites variously in Camberwell, Hawthorn and Newport being listed as a result. And I want to thank those people for, as soon as they were advised of their primary close contact and their positive status, isolating straight away. These are the encouraging, positive parts of where we're at, but we know that this virus is still active in our community. We still know that there are chains of transmission in our community. Yes, they're all linked, that's positive, but they're still there, and that's a risk. Of today's 12 new community cases, 5 cases are linked to the Amy Park outbreak. 1 is a social contact of a previously identified case that attended the game, and 4 household contacts of a previously announced case. So that's 5. A further 3 are linked to Miss Frankie's in Cremone. 1 is a patron who visited the venue on July 15th, and 2 are household contacts of a staff member. That's 8. There's a further 2 linked to the Burnley apartment complex, where a positive case who was there but had moved into hotel quarantine some time ago. We've seen 2 fellow residents who live on the same floor as that person who had previously been announced turn positive as a result of their most recent tests. So that brings us to 10. 1 is linked to Bacchus Marsh Grammar, a student. That's 11. And 1 is a household contact related to one of the generations attached to the Young and Jackson's case. So that brings us to the total of 12. Today we also have some now 22,718 primary close contacts associated with these 159 cases, and now we have passed more than 400 exposure sites. So just pause on that. 22,718 Victorians are doing the hard yards on behalf of us all to make sure that we isolate these chains of transmission as quickly as we possibly can. And can I thank all of those people? It's an extraordinary number. It's the highest number that we've had during the course of the pandemic, and those people, the support that community is bringing them, that health services are bringing them, that families and others are bringing them, is critical. And I want to thank every single Victorian, both those 22,700 and others who are part of the frame of making sure we get those people through their isolation period, because that is just so important. More than 20,000 Victorians isolating the home is not easy, and of those, 2,500 are from the MCG alone, and they are now hitting their day 14 test mark. We have cleared almost 2,000 of the personal close contacts from the outbreak so far, and we will see around another 4,000 day 13 tests over the course of this weekend, with a further 8,000 due in the coming week. So that's an extraordinary number of people who will start to be cleared through this process. And I want to thank the huge cooperation that they've lent, but equally, just ask them for just one big last effort in getting us through those 14 days. If you are a primary close contact of a person with COVID-19, or you're at a Tier 1 exposure site, in order to end your isolation at the end of your day 14 of isolation, you need to get a day 13 test, and for that to be negative. At some time before your day 13 test, you will receive a message reminding you of that day 13 test requirement. You should and you must get that test. If you don't get tested on day 13, you must in fact stay in isolation for a further 14 days to bring your total to 28 days, or until you get that negative test. So please, if you're in that category, stay alert to the phone calls and engagement that you will get from local public health units and the Department of Health. Please also do not take public transport or a taxi or an Uber for that day 13 test. If you test negative, you will be contacted on day 14 by phone for a short public health assessment just to clear you. This is a straightforward process and is the last step for you as a primary close contact, and that will then formally end your isolation as of 11:59 p.m. that night that you are cleared. We need your help. We need the help of thousands of people over the coming days to make that process a success. So we ask everyone to cooperate with the frontline workers who will be working hard to get you tested, to get you at a testing site and through what will be a pretty big mass operation, and to get that through as smoothly and quickly as we possibly can. Thousands of calls are being made every day to those primary close contacts as to how to make this process happen seamlessly. Those calls are there to help you, and they're there also to help all Victorians get through what will be a major logistical exercise. These calls come through as private numbers on your mobile, so please make sure you keep your phone handy and make sure that you take that private number call as you hit your day 13 and day 14 tests and clearance. And that last call is the one that gives you and us the confidence that you are free of COVID, that your family, your friends and your community will welcome you back for the hard work that you've done on getting us all through this arrangement. So make your plan, get your test, and thank you very much those thousands of people for doing the hard yards in keeping us all safe. I might ask the Chief Health Officer for a more detailed update, and then Naomi will take us through some of the latest arrangements on vaccinations, and then I'm happy to take questions.
Thanks, Minister, and good morning. As the Minister said, we've got still more than 20,000 Victorians isolating at home. That's a big sacrifice, but it is a necessary one. With this Delta variant, we are seeing multiple cases in residential settings, of course, including apartment complexes. And just yesterday, our continued investigations of positive cases and their movements turned our focus to an apartment complex in Docklands. There are teams on site now who are deep cleaning common areas and will be testing people throughout the day, today and tomorrow. Residents have all been advised that due to a case of COVID-19 in the Lacrosse building at 673 Latrobe Street, Docklands, that they're required to isolate immediately until further notice. Residents will be contacted throughout the day to give them a time to attend a pop-up testing clinic being set up to perform testing for the residents of the building, and after testing, residents must continue to self-quarantine until further advice is issued. It's never easy receiving that news, to know that you are potentially exposed, to know that you need to quarantine until we make further assessments and get results back. We do understand that that'll be particularly challenging, but as it is the case for 20,000 plus Victorians, that is a sacrifice that we're so grateful for to keep all of us safe. Those testing results that come through today and tomorrow will give us the information we need to be able to make an assessment of that location and exactly what the response needs to be in coming days. We're not taking any chances with community transmission of this Delta variant that's come from New South Wales, and that's why we've changed the Victorian travel permit system to account for the greater risks posed by COVID outside of Victoria. The Victorian travel permit system now designate areas across Australia and New Zealand as green, orange, red or extreme risk zones based on public health risk. I declared New South Wales in total as an extreme risk zone from 9 p.m. last night. It's backdated 14 days from 9th of July. Victorian residents returning from a red zone who've been in an extreme risk zone in the last 14 days can only enter Victoria with an exemption, exception or another valid permit, such as a specified worker permit. Those red zone permits for ACT, Norfolk Island and South Australia will function as they have previously, so with a right of return of Victorian residents to come to Victoria. But people with a red zone permit must return straight home or to wherever your accommodation is in Victoria and self-quarantine for 14 days from the day you enter. You need to have a test within 72 hours and again on day 13 of your home quarantine, and then to complete that full 14 days. We're on high alert interstate, but also here in Victoria. In addition, our wastewater testing's operating across the state with a particular focus in the border communities. And overnight we have had a strong new detection in the Glenroy area from samples taken on the 21st and 22nd of July. The suburbs within the detection area include Glenroy, Hadfield, Oak Park and Pascoe Vale. We know some red zone permit holders have returned to these suburbs and the virus may have returned to with them. So we're asking everyone that they all need to keep getting tested right across Victoria. But if you're symptomatic and in those particular postcodes, we absolutely encourage you to get tested. Our testing numbers are strong, but we do need to keep it up. I'll finish there and hand over to Ms Bromley for the vaccination update. Thanks.
Now, I forgot to mention that Brett has to leave at 12:30 for AHP.
Thanks very much, Brett. We hit a great milestone in Victoria yesterday with 3 million doses being delivered right here. Half of those have been delivered in our state clinics and half have been delivered by our fantastic primary care providers. In our state system, we've delivered 1 million first doses and about 500,000 second doses. And I'd like to thank all of the healthcare providers who have made that possible. There's been a lot of discussion about the vaccine supply here in Victoria and all across Australia, but there are appointments available across the system here in Victoria. Every week, more appointments are being made available in the state clinics, and there are many appointments available for AstraZeneca, and more primary care providers are starting to use Pfizer now and over the coming weeks. We've seen Victorians come out in really big numbers. We know that there are many Victorians who are keen to get vaccinated and who haven't yet or haven't actually had the opportunity yet. I really encourage and urge all the people who are eligible to be vaccinated to plan in advance, look out for those appointments and try and get it done now or as soon as possible. Every additional dose in a Victorian arm helps keep us all safe. In the coming weeks and months, you'll see more pop-up clinics in Victoria, in church halls, town halls and community centres. Some of these sites will be targeting people who are experiencing homelessness or other forms of disadvantage. We really want everyone in Victoria to have the opportunity to get vaccinated no matter what their circumstances are. It's very pleasing to announce that we now have 50 open access clinics or vaccination centres operating across the state, and they're located in our CBD, in our suburbs and all across regional Victoria. The recently opened Frankston Community Vaccination Centre is our 50th state-run vaccination hub. It's in a very convenient location in the local shopping precinct, which is fantastic for that community. That's the Bayside Shopping Centre, which is 200 metres away from the Frankston train station, and that means that it's convenient not just for that local community but for other communities in the southeast. The early focus at that clinic has been on priority cohorts, healthcare workers, etc., but there are Pfizer appointments now becoming available for the general public. As always, bookings can be made through the Department of Health website, and of course you can walk in if you're aged 60 or over for AstraZeneca. Again, thank you to all the Victorians who have made it possible to hit that 3 million dose milestone. Thanks, Minister.
Take questions.
Well, should we ask Professor Sutton, seeing he has to go?
Yep.
Professor, how many of those that tested positive today have an association with Prahran market, and what percentage of the tests have you got back from there?
So there are none positive today that are related to Prahran market. As the Minister detailed there, they're primary close contacts, existing primary close contacts, but none relate to Prahran. I don't know the figures for those tests that have been returned from Prahran, but we had a strong testing response from many of those who'd been identified through the QR codes from Prahran yesterday. We can provide an update in the Cho update this afternoon.
So that must be a relief, given that was a big concern yesterday.
Well, certainly it was our focus yesterday. As I've said many times previously, you never know for that one individual if they're going to be very infectious, not infectious at all, or somewhere in between. Prahran market obviously has a lot of people who you don't normally know around you, and so it was really important to have people come forward for testing really quickly, but to have no positives come out of that thus far is certainly reassuring. It's a reasonably open space. There's some decent ventilation by virtue of that ceiling space, but of course the risk is always there in crowded locations.
We're hopefully moving out of lockdown soon. Do you think, considering this new risk that Delta is posing, we're going to have a higher level of base restrictions moving forward than we did previously? And if so, what would that look like?
Oh, we'll have to consider all of that. Certainly, Delta is more infectious. It puts everything on a knife edge in lots of ways. We need to ensure that zero community transmission status for Victoria in order to manage that risk. And so we'll look at all of those settings and all of the mitigations that need to be in place for it. Masks become even more important in an era of the Delta variant. They've played a huge role, as has been highlighted by recent literature from the Burnett Institute. And indeed a review of our second wave in Victoria last year, the critical role that masks have played. So that'll be one of the baselines that we'll just need to live with globally. It won't be unique to Victoria or Australia. They're reviewing the advice on masks in lots of places where there's very high vaccination coverage because of the resurgence of the Delta variant and kind of third and fourth waves in a number of countries.
Are you sporting crowds as well, given what's happened over the past couple of weeks?
I think so. We'll have to consider it for anyone everywhere in terms of the potential risk and those particular settings where the risk of transmission might be higher, and when we're coming together with strangers or in large numbers, that becomes a particular focus.
163 cases in Sydney overnight. Are you comfortable with the restrictions that we have in place in Victoria to prevent that increase of cases coming across the border?
Yeah, certainly we're doing absolutely everything. That extreme risk designation for the whole of New South Wales is part of that. It's very tough for people who are normally resident in Victoria to be stuck outside the state. Of course, there are those exception and exemption processes that are in place, and that's for people who've got really urgent and humanitarian needs to come back to Victoria. But it's very strict in terms of the movement of people across the border being minimised to the fullest extent we can.
Can you
the
explain?
protocol system was supposed to bring certainty, though, to interstate travel. Does this addition of a new layer with no warning, no consultation with the community undermine that certainty?
We've had to be agile right through. The threat posed by New South Wales, and everyone would expect us to be agile and responsive as new risks emerge, is exactly that. We did flag it. We flagged that anyone who leaves Victoria is going to be subject to potential changes of zones. This is actually not a change for New South Wales. Because we said that we would need to do a pause for Victorian residents coming back to Victoria from red zones. What it effectively does is allows that right of return for people in South Australia, ACT, Norfolk Island, going forward, because they remain as red zones, but that default right of return for Victorian residents is able to be put into effect. But the management of those in New South Wales is entirely about protecting Victoria, and I think everyone here expects that that should happen.
Professor, the New South Wales Health Minister has responded to Premier Andrews' suggestion for the Ring of Steel. So recent comments, his entitlement to deal with his community is the way he wants to deal with it. He noticed the police unit had expressed concerns, and he doesn't see it as being an appropriate approach. What do you make of this?
Oh, not for my comment. I'm a public health physician in Victoria.
Well, given the Premier's not speaking today, can we get any type of...
Maybe the Minister can provide it.
Can we just ask Brett a couple more questions before you go? So, but in practical terms, can you explain the difference of an extreme risk as against a red zone? Just in practical terms, what does that mean?
Look, it really does relate to the caseload in any one jurisdiction, the trends over time, how much we expect cases to emerge each and every day. In South Australia, they've had a dozen plus cases over the last few days, but they're in lockdown. Those numbers seem to be stabilising for a population of over 1.5 million. For New South Wales, 163 cases today, close to 2,000 active cases now. That's a big caseload. The risk of people coming from New South Wales having been potentially exposed to others who are infectious is much higher than for South Australia ACT. And so it's managing that hopefully proportionately. And it, like everything, will undergo review at regular intervals. If we need to upgrade other red zone areas, we'll do that. If at any point we can downgrade New South Wales or parts of New South Wales, we'll do that as well.
Professor, in terms of the vaccine, you're meeting with the HPPC today, you guys meet regularly. Have you discussed what the benefit would be of sending more vaccines to Sydney in terms of actually controlling that outbreak? And I guess what's your assessment about how beneficial an exercise that would be?
Look, I think that's primarily a discussion for First Ministers through National Cabinet. AHPPC would be keen to support the kind of modelling that would indicate where vaccine might need to go, how much, when it needs to be distributed, and what kind of a difference it would make to the risk of transmission. That work hasn't been done. Obviously, the issue was only raised at National Cabinet yesterday, but to the extent that we can support with an expert view on what higher levels of vaccination and where they should be targeted and to whom, we're happy to provide that. Equally, ATAGI really had the expertise in terms of what the dosing intervals for Pfizer and AstraZeneca might need to be, given the epidemiology in different places around Australia.
Do you see a benefit for Victoria in New South Wales getting more Pfizer into arms, given that the extent of the outbreak there?
Look, I think we'd be happy to support in whatever way we can, but we need to understand how much, when, where, and to what extent it might make a difference.
In terms of the epidemiology, people might look at it and go, how is giving extra vaccines right now going to stop this outbreak where they're getting 163 per day? So what could it actually be used for to stem the spread of cases up there? Say it was here, what would you use it for to stop the spread?
Look, it doesn't change immediately anything in New South Wales, but it is potentially looking to the medium term to try and put the brakes on further transmission, either beyond the area where it's geographically concentrated, or to slow it down over time. If that saves thousands of people from infection and many people from dying, then even if it doesn't have an immediate effect, it's something worth considering. In Victoria, we've got to balance our own risks. We need to protect Victorians both from potential incursion, but also all the future risks that will continue to challenge us through to the end of the year. Having high vaccination coverage in Victoria is the way to do that primarily.
Would you be comfortable providing our allocations to New South Wales, given that's what the New South Wales...
That's not my role. My role is to provide some public health advice about what it would mean for transmission in Victoria and the risk and what it might help to do in any hotspot area of Australia.
What would you need to see in terms of data between now and Tuesday to give that advice that the majority of the restrictions could lift?
Well, certainly we've said we're on track. We're needing to see those numbers who are out in the community for any period of time to be really minimal and hopefully zero. That's where we're at today. That's where I want us to be for the rest of the week.
If Victoria did provide doses of Pfizer to New South Wales, do you think that would have any impact on the transmission of the virus in Victoria?
The thing that will make a difference on the risk of transmission in Victoria is everything that we're doing. It's masks, it's our social distancing, it's the compliance with the restrictions that are in place, and it's absolutely getting tested for anyone who's symptomatic or everyone who gets flagged as being a primary close contact or going to an exposure site. The role of vaccines is a medium to longer term role. It doesn't change the game overnight. But it's clear that the higher the proportion of the Victorian population who get vaccinated, especially fully vaccinated, makes a difference to the dynamics of transmission. That'll protect us from small incursions. They'll be easier to manage over time, but ultimately it minimises our risk of being hospitalised and dying from this awful virus.
Are you going to need to be more cautious moving out of this lockdown than the previous one, considering the situation in Sydney and Delta variant?
We'll absolutely consider the risk outside of Victoria, as well as watching everything in terms of exposures within Victoria. That'll has to come in as part of the equation. But the primary means of managing the risk outside of Victoria is through that extreme risk designation and the great work of Victoria Police in managing people moving across the border.
And so, in a nutshell, how do you then feel about Tuesday at the moment?
I feel like we're on track. I have been surprised in the past, pleasantly and unpleasantly. I hope that this weekend brings us further good news in terms of everyone being in home quarantine or isolation throughout their whole infectious period. That would be really good news for Tuesday.
But it doesn't have to be zero cases. If there's zero people infectious, you'd be happy with that, even if there were still cases being reported?
I expect there'll be further cases. There are people who are still quarantining at home with other family members. Some of those family members might have even separated at home through the quarantine period, but have been exposed early on, might turn positive, in their 14-day period. So there'll be new cases. I expect there'll be new cases probably right through to Tuesday. They should be decreasing over time. We've got a a public health response that's wrapping around all of those primary close contacts, but new cases will emerge. That incubation period of 14 days means that you can turn positive, become a case at any point.
Is there a magic number we should be striving towards? I know formally
No magic numbers.
have said less than 5 cases.
No, there's never been a magic number. There never will be. They're part of our overall assessments, but the key aim is to have no new exposure sites emerging. If they happen to emerge, to have that level of confidence that we can chase them down, that they're known, controlled, and that we can respond to them quickly.
So you mentioned exposure sites, so we've got over 400 at the moment. So how does that play out then?
Yeah, look, those 400 have largely tapered off in the last few days. That's the really good sign. There may be 1 or 2 more that come over the weekend. And again, you never know what tomorrow can bring. But being able to respond to those exposure sites, and for Victorians to respond by checking the exposure site list, getting tested as appropriate and quarantining is the management strategy for all of those.
Do we have to have a 0 number in the community by Tuesday before we come out?
No, there are no absolutes here. We make judgments on all of those aspects, and you know, if there's a case who's in the community, but we can chase down all of their close contacts in a timely way, then that doesn't mean that it puts everything on hold.
Many regional Victorian communities haven't had any cases at all and are still following the restrictions of Melbourne. Do you envisage on Tuesday, if restrictions do ease, that regional Victorians will face different easings than what Melbourne would?
Nothing to announce today. We'll go through the review process over the next couple of days. There are still hundreds of primary close contacts out in regional areas. If there were new cases who emerged there, you know, we'd have to be assured that they've had their entire infectious period in isolation. You know, you've got to feel for regional areas that have had no cases, but Mildura will tell you that they were probably shocked into their response. Not that they've been complacent, but we all get unused to COVID if there's been no experience of having to deal with it. They've done such fantastic things in response to the cases they've had, but no one should say, you know, if today looks like this, that tomorrow couldn't look different, because it absolutely could.
Minister Foley, we'll let you go,
Thanks.
Professor. Thank you. Minister Foley, just following up on New South Wales.
Yeah.
Health Minister says he's disappointed in other states for not helping out with Pfizer. He pointed out New South Wales helped Victoria during the fires. He said there's no difference between beating back flames and beating back COVID. Is that fair?
I've got nothing but respect for the New South Wales Public Health team and their minister. They're dealing with extraordinarily difficult circumstances. Victorians know those circumstances only too well from our own winter 2020 experience. So our position is the position of National Cabinet, and indeed the position that the Commonwealth put to the Senate yesterday. And that's pretty clear, that we all get allocated Pfizer and AstraZeneca, and soon Moderna, based on our proportionate part of the Australian population. I've seen media reports today, and I've been in conversations both with the Commonwealth and New South Wales, that if in fact there is unallocated vaccines in the national stockpile, then I don't think any of us have any difficulty in that being prioritised in the area of greatest need in the Commonwealth. And the Commonwealth of Australia's greatest need at the moment is clearly the situation in New South Wales.
So you won't give
so
them
if there's unallocated stock, then by all means, provided it's not coming at the expense of any state or territory, all of whom have legitimate demands and scheduled demands, if there's unallocated stock from the national stockpile, then I'm sure we all support that going to the area of greatest need in the Commonwealth.
But we won't give them what we currently have.
Well, all of our allocation is allocated. We have, in the weeks ahead, as Naomi indicated, a program of allocations set out in now over 50 open access sites and hundreds of general practices and primary care locations, and I'm pleased to see an increasing number of community pharmacies coming on board. And the allocations we've got running at the moment at the state level between about 84,000 and 102,000 a week are all allocated and are all scheduled. I was pleased to see there was reports today of potentially unallocated stockpile in the national medical stockpile, and if there is in fact unallocated material, then I'm sure all of us support that being prioritised in the area of greatest need.
Minister Hazzard has made some pretty forthright comments, though, about us being in a Commonwealth and having to remember all the states are in a Commonwealth. He said he remembers sending his own health professionals to Victoria when we were, in the depths of it last year, and that they risked their lives to help our community. Some sort of loaded comments there this morning, which I'm sure you're aware of.
Yes.
Are we going to respond to that by sending extra people up there to risk their lives for New South Wales, those affected there?
So I'm sure I speak on behalf of all Victorians and all of our healthcare professionals. We want to thank New South Wales, South Australia and Western Australia for what they all did in the depths of our second wave outbreak for the support of both healthcare staff and aged care staff that were brought to Victoria. It showed us at our best, frankly, and that's why the conversations that I've been having with New South Wales and the Commonwealth reflect that same, we are actually all in this together. Having said that, what we do have is a scarcity of vaccines for at least the rest of July and August before it starts ramping up in September. It's all allocated. I was pleased to read reports of unallocated stock in the national stockpile, and I'm sure it reflects the position of us all that if there is unallocated stock, that it should go to the area of greatest need. And in that regard, I think it's pretty hard to argue that the area of greatest need is New South Wales.
But Mr Hazzard is basically saying we're not all in this together. He questioned the Commonwealth. How do you feel about that?
I've seen the comments in transcript, but I've also had numerous discussions with Minister Hazzard. He is a senior minister in a New South Wales government, and he's one of the most experienced health ministers in the country. We have a very close working relationship. He rightly puts the needs of his state first and foremost. He also understands that other states have demands on their supplies for vaccinations, and we're all working through the cooperative framework that we can to make sure that if there is unallocated vaccines, that they're provided to the area of greatest need.
But Minister, didn't you feel, after everything Victoria has been through,
Yes.
didn't you feel angry when you saw that?
No, not at all.
He's saying we're not being part of the Commonwealth.
No, I think you misjudge the extremely cooperative nature of how health departments, health ministers, health services work together across the country.
But what he said this
there is
morning was
no
the
anger
opposite
and
to
there is
that.
no frustration.
But what he said
between
this morning,
states and
Minister, was the
territories when it comes
complete
to these
opposite,
issues.
that there is no cooperation, that we're not acting as states in a Commonwealth. They were his words, we're not acting as a Commonwealth. And the inference is there is no cooperation.
Well, I haven't seen the delivery, obviously, but I can assure you that from cooperation, from conversations that all the health ministers have, that I have had directly with Minister Hazzard, that there is a high level of cooperation. And I thank New South Wales and other states and territories for the support that they lent Victoria. And in regards to that, that was always underpinned by the principle of if there is extra resources, if there is extra availability to deliver services that don't put your delivery of health services, and in this case vaccinations, at risk, then of course we all put our shoulder to that wheel. So I know Minister Hazzard's comments, as I understood them from my direct discussions with him, in the framework of what can we do as the Commonwealth of Australia, the Commonwealth Government and the states and territories governments to all make sure that we deal with this. As we've been making clear for 5 weeks now, New South Wales' fight is Australia's fight. We can't ultimately beat this as a nation until such time as New South Wales gets on top of their wave of outbreaks at the moment.
But still,
hang on. That cannot be at the expense of then allowing the further importation of that wave into any other state or territory. We all have to do what we need to do, what our communities expect us to do, what our public health officials tell us have to be done to allocate a scarce resource, in this case vaccines, to the areas that we need to cement our public health position, whilst at the same time, in a scarce environment, trying to address New South Wales' clear need. So on that basis, I'm very comfortable with the cooperative relationship that we have with New South Wales and every other state and jurisdiction. And as I say, the reports of unallocated vaccine, if that's the case, then I'm sure we all support those going to the area of greatest need.
You talk unallocated, but just to absolutely confirm, any vaccines allocated to Victoria, you wouldn't provide to New South Wales in a time of need?
No, and I don't think New South Wales or any other state or territory would expect us to, because they are allocated. That would mean counselling appointments. That would mean taking arrangements off GPs who, as Naomi indicated, provide half, and over future weeks and months to come, more than half of the vaccines that we do here in Victoria. This is one of the problems of a relative scarcity of supply. That will start to change as of the end of next month, and we are looking forward to that process. The real question is, how do we all support New South Wales and any other state or territory, whilst also making sure that the fundamental position of our first and primary obligation to the protection and well-being of Victorians is managed in that context. The two go together. They're two sides of the one coin, because you cannot ultimately protect Victoria unless it is brought under control in New South Wales. That's where the hard and increasingly tough border restrictions come in place. That's where our arrangements about making sure that we restrict movements of people who want to come from New South Wales into Victoria. But it also includes, if there's assistance we can lend in information, in community engagement and in unallocated vaccines from the national stockpile, then of course we should do that.
At the very least, Mr Hazzard today is grandstanding and playing politics, isn't he? Because he's clearly, what he's telling you privately, he's not saying publicly.
No, he's saying the same thing, I think. I think he's saying exactly the same thing. He's saying that none of us can be certain of a COVID-safe future until the whole country is part of that. But of course there are challenges at the moment, significant challenges, particularly in New South Wales. We have our own challenges here in Victoria. My primary responsibility is to address those challenges right here in Victoria, to get on top of this current outbreak and to roll out the vaccination program in the interests of Victorians. We cannot ultimately be successful in that effort until the rest of the Commonwealth is also protected. And that's where the tension has to be resolved. And I've got nothing but support for the cooperative relationship that we have with Minister Hazzard and his health professionals and their health services. Genuinely, we are all in this together.
Victoria's decision to slap that new layer of declaration on New South Wales has come after a national cabinet meeting where presumably issues were raised and Victoria didn't get what they want, and then today Minister Hazzard has come out and attacked Victoria. So is it showing that the national cabinet process is broken?
No. With greatest of respect, twice now you've characterised the extremes zone as a response to National Cabinet yesterday. That is not the case. The arrangements that have been in place for some time now for New South Wales on our traffic light system bore a relationship to circumstances that had been brewing for 5 weeks. 5 weeks ago, we made it clear that please do not go to New South Wales. Every opportunity we got since then, we've escalated the measures proportionate to the risk. These measures about the extreme allocation to New South Wales were prompted as a result of also South Australia ticking over into the category of having to be declared a red zone. Clearly, the risk in South Australia is different to the risk in New South Wales. So the public health orders changed accordingly. So to characterise it as some kind of response to National Cabinet or some anti-New South Wales position is both wrong and one I clearly reject.
Brad Hazzard also spoke about the Premier's request yesterday on a ring of steel around Sydney. He said Mr Hazzard said he intentionally hadn't kind of spoken negatively about other states or given them advice.
Yep.
Why is it Victoria's prerogative to kind of give requests or advice on what New South Wales should do?
Well, I concede that Mr Hazzard has not provided Victoria with advice, but I can recall some fairly frank and direct advice from Commonwealth ministers, particularly as we were coming out of the second wave last year that was problematic at best. I think that that if we all look to our own backyards, that's where our responsibility starts. But in terms of the position as a ring of steel, Victoria made its position pretty clear in 2020 that rings of steel around concentrated areas of chains of transmission and virus circulation, as tough as they are, as hard as they were an important part of the armoury and the toolkit that the public health team had. And I think they played a role in the successful crushing of the second wave in our 2020 winter. Victoria, through the National Cabinet process, presented that. It's up to New South Wales if they want to enforce that or take up that offer. Clearly, as I understand it, National Cabinet determined that that was an issue for New South Wales. So it's an issue for New South Wales.
Were you disappointed the Prime Minister and New South Wales appeared to just dismiss it out of hand straight away? Didn't even really think about it?
No, I'm sure it was given consideration, and I'm sure that we all hope that New South Wales get on top of this as quickly as they possibly can. But I don't think we should be ruling in or out any measures, however tough, that need to be contemplated. We can look to the example of what was successful in Victoria, as tough as it was in 2020, and we can learn from that in other jurisdictions. And those learnings stand there as a clear example of what works.
They blatantly came out, though, saying that it doesn't seem to be the appropriate approach. And to quote Mr Hazzard, we already have limits in terms of workers being able to come out of the 5 most challenged LGAs. So I think that's appropriate as to the balance we've struck to date.
Oh, well, that's a judgment that New South Wales are making, and I hope that judgment is right. But I would urge any jurisdiction to not rule in or out any measures that our lived example shows, as tough as they were, worked.
But Minister, to your point, we've been through this. We've gone from 700 daily cases down to 0. So why are they not listening to?
Well, I'm sure they are listening. Each jurisdiction makes its own judgments based on its public health advice. We'll continue to share our advice, our experience. We continue to point to, as the Chief Health Officer pointed out, things like the recent Burnett Institute report that picked a whole range of measures that all go together into the amalgam of measures that helped Victoria successfully knock over the second wave. Those same learnings have helped inform us how to respond to this particular outbreak that we're dealing with at the moment. The circumstances have changed. This is Delta. It's at least twice as infectious. It moves quicker. All of those factors all need to be brought to bear.
Must be frustrating though, Minister. I mean, as we've just said, we went from 700 to nothing, and now New South Wales is sadly not there yet, but in a similar predicament. For us to hand over advice like the Ring of Steel and other things, it must be frustrating for you to be slapped down. Surely, behind closed doors, you're thinking, well, we've done it, it worked, and they're just dismissing it.
I wouldn't use such colourful language. I don't feel frustrated, nor do I feel slapped down.
But it was pretty quick to dismiss the idea, an idea that you would argue did work.
Especially since the virus now is seeping into Victoria, so we're bearing the brunt.
Let's be clear, this virus started in Victoria by incursions from New South Wales. The last May-June outbreak was seeded from Adelaide. We can't dismiss the fact that all of our learnings from each other need to be shared so as to avoid that proposition. We'll continue to share not just our experience of the second wave, the benefits that masks bring, the key importance of working cooperatively with multicultural and at-risk communities, the importance of supporting our healthcare workforce, the learnings that we took from residential aged care, and the learnings that we took from things like the Ring of Steel. All of these things are the lived experience of Victorians, and I'm sure that there will be experiences from New South Wales dealing with the Delta virus, a Delta variant of the virus, that we can all learn from. And the cooperative processes that we have in place at the health ministers and health jurisdiction level will continue, I hope, to be freely shared, and then it's up to each state and jurisdiction to pick that up.
Victorians were told that the 3 removalists who came from New South Wales and brought this virus to Victoria, causing our 5th lockdown, would have the book thrown at them. Yep. We were told that they breached restrictions by not wearing masks, by not complying with the rules. There's a report overnight saying that these removalists won't face charges, that they may actually, in fact, just face a fine for not wearing a mask. What's your advice on this case?
Well, my advice is that unattributed reports are unattributed reports. What I know is that the Department of Health and Victoria Police are continuing to work through all of those issues, and that the normal processes of justice across 3 states will apply, and I know that that's not for ministers to comment on whilst those processes between health compliance officials and Victoria Police are underway.
After this government has talked so big on punishing those sorts of people, you would, though, be very disappointed if they weren't punished at all.
Well, it would not be appropriate for me to comment on Victoria Police and health officials' compliance activity, which is yet to be completed. So I'll let Victoria Police's process, in consultation with our health officials, land at the appropriate resolution.
Why then did Jerome Weimar, about a week or so ago, say we're going to make sure the book is thrown at them?
Well, presumably because we genuinely believe that there were breaches of the Chief Health Officer's orders. Our compliance officials and Victoria Police are working through the normal processes of how our justice system works, and that justice system rightly separates ministers from enforcement, and I'll let Victoria Police and our health officials go through that process.
Minister Foley, an Echuca pub was fined more than $22,000 for opening against lockdown rules. Businesses are struggling, and you've got 3 removalists who have done a clear breach, and it's led to this outbreak. So how is that fair?
Well, I think there's a qualitative difference between a publican who chooses deliberately to flout the laws and being advised by Victoria Police not to then still go ahead, on one set of factors, and that's been determined by Victoria Police, and I'll let Victoria Police determine on the evidence, on the material provided by Health, as to the other set of circumstances. It's up to Victoria Police, through the normal processes of our justice system, to make sure that these arrangements are applied fearlessly.
But the end result of what the removalist did was far, far greater than anything the Chuka publican did.
Absolutely.
So therefore, you would hope that the punishment would be there. Particularly if you, as you say, your department genuinely believes they have breached the law.
I will let Victoria Police and our health compliance officials proceed down the normal justice system processes to make sure that these arrangements are tested and applied appropriately. I don't have the advice that you referred to in the media reports. I'll let Victoria Police and our health compliance people go through the appropriate, independent from members of parliament, decision-making processes here.
And just your response on more anti-lockdown protests again today. What's your message?
Oh, look, beyond disappointment. I recall hearing Professor Peter Doherty speak about the choices that we all face here in Victoria, indeed here in Australia. You're either on the side of the virus or you're on the side of humanity. You can't be on both. And if you choose to flout through these kind of ratbaggery efforts to challenge somehow or another your constitutional right to ignore the virus, then you're on the side of the virus. Don't do it. It's not in your interests. It's not in the interests of Victorians, and it will make no difference. In fact, it will set back the opportunities for us to get back to a COVID-safe status as soon as we can. It places at risk the work we have all done. So please, be on the side of humanity. Do not be on the side of the virus.
Oh, sorry, I've just got one more question for Foley, unrelated. Save Victorian Events were outspoken this morning, concerned that Save Victorian Events, just about being left off government planning roadmaps. So photos are currently circulating online showing the Queensland Premier encouraging mass-scale celebrations since they've got the Olympics, but hundreds have gathered, and, you know, don't you think this is a bit of double standards when events can't proceed?
No. It's not double standards. They don't have change of transmission in Queensland. We do. We've had 2 incursions from New South Wales. Each set of circumstances has to be dealt with on its circumstances, on its merits. Good luck to Queensland having got the Olympics. It's fantastic for them and for, I'm sure, Australia, but I'm not sure how that brings into question our public health arrangements here in Victoria.
Can I ask the Deputy Secretary?
Sure.
Just on kind of vaccine supply and demand, can you clarify how many, if any, Pfizer first doses we have available, and are we really kind of getting appointments to use up every single first dose of Pfizer that we have?
Yeah, absolutely. So our focus is to put in place all the appointments to use up all of the doses that we have available here in Victoria. That's the absolute focus of our team. We open up appointments in advance, a few weeks, so whenever we have additional supply clarity coming forward, then we open up those appointments over those coming weeks. There are opportunities sometimes for us to look across the system and harvest additional appointments and reinsert those back into the system, and that's why it's really important for Victorians to keep monitoring the online booking system or call up the phone line and see if there are additional appointments available. Make those plans, get your appointment booked if you're eligible.
And do you know how many, if any, first dose appointments we have available now?
Yeah, so I think next week we've got around 4,000 first dose appointments available in the system for Pfizer. They're spread out across the system, obviously, so some might be in regional and some might be here in metro. Over the coming weeks, that'll tick up a little bit, but we've seen a really good uptake over the past couple of days in particular. people are really being proactive and getting on and checking those appointments and getting them booked in.
Are people who are due to get their second injections, do they automatically or should they be getting automatic messaging the day or the day before to remind them? Because we've had reports that they're not.
Look, I think there's good systems in place to both help people and remind people to get their second doses booked in, and we always remind people through this mechanism and also through social media to do that. There are mechanisms in place if people haven't booked an appointment. They show up on our system and they'll get reminders coming through at different intervals to remind them that they're falling due for their second dose and to get that booked in. But actually, by and large, Victorians are booking in for their second dose appointments and turning up and getting those second doses in, which is really, really important.
But there's not an automatic message, so could that explain why previously there have been so many missed appointments, that they don't have that extra reminder in the day before they're meant to arrive, say, for instance?
I'm not sure that that's quite true. I think that there are lots of reminders, particularly if people are showing up in our system as having a first dose but not a second dose. They'll get a series of reminders to book in and do that. We do have some people who don't turn up for their appointments, but actually I think that do not attend is quite low here in Victoria. I think it's somewhere around 5%. So it's not actually a huge issue. People generally do turn up for their appointment when they've booked in.
Are we seeing doses of AstraZeneca expire in Victoria?
No, not here in Victoria.
And in terms of demand more widely and possibly hesitancy, do you think there are Victorians who are holding back from coming forward and getting vaccinated, people who are actually eligible?
Look, I think there are some people who have really valid questions and concerns, of course. There is a lot of information out there available. We also have community ambassadors who are really active in their local communities and networks. They're a fantastic source of information. And of course, people who do have questions or concerns, best advice is for them to book in and have a chat to their GP about their particular circumstances.
All good? Thanks,
Thank you.
Great, thank you.
Well done.